Hello, Representative Collins. How are you today?
I'm doing well, doing well.
All right, nice to meet you. Well, my name is Kwame Pathay, and I'm a political science major and philosophy major at Furman University.
Okay,
Hi, my name is Brianna Masol. I'm now junior from Greenville, and I'm majoring in public health.
good.
And I'm Price St. Clair, also a junior. I'm a politics major from Boone, North Carolina.
Wonderful.
Well, we're members of the Raleigh Institute's advanced team, and we are a group of Furman University students interested in government and public policy. And while we wish we were on campus to meet with you and speak with you, we understand everything going on with COVID-19, and we understand you're very busy. So we're engaging with speakers that we have brought to Furman in the past, and we just want to get a sense of your perspective on COVID-19 and how it's been impacting various aspects of people's lives.
Today, we're joined by Neal Collins, who is a Republican member of the South Carolina House of Representatives representing Pickens County in District 5. Representative Collins is a graduate of Furman and has been a panelist for the Raleigh Institute Straight Talk series.
Representative Collins, thank you for taking the time to talk to us today. Our first question is, as a member of the South Carolina House of Representatives, we were wondering if you could shed some light on the conversations that are happening among state legislators as South Carolina reopens, and what you are advocating for in terms of testing and tracing, as well as plasma donations from patients who may have recovered from COVID-19.
Absolutely. Well, good question, and thank you all for the invitation. As a Furman alum, I'll do anything for Furman or for the Raleigh Institute specifically. But I thank y'all for being involved in both public health and politics. We need more and more good people to do in both of those sectors. So I encourage you to continue being involved like this for the rest of your life. So going to COVID, I specifically remember when I realized I need to do some research on COVID. And that was on March 11th. We had just finished the budget in the South Carolina House. We spent 3 days, Monday, Tuesday, Wednesday, passing the budget, and I was driving home, and on the radio I was told that Furman University made the decision that students were not coming back to campus. So I credit Furman for piquing my interest and raising my ears to, all right, this is a serious issue. Up until that point I had heard it, but I had done no research on the matter, and but I knew if my alma mater was taking it that serious, then I needed to get updated. So I got home about 2 o'clock that afternoon, and for the next 7 hours, that's all I did was research. And then President Trump had his press announcement that night, pretty much banning travel to Europe, which is unprecedented in my lifetime. So all of that kind of culminated into, for the next 3-4 weeks, about 15, 17 hours a day, all I was doing was COVID-related matters. And I'm heavily involved in the education policy world. And from the very get-go, on that Thursday, March 12th, was with some contacts in the governor's office and fellow colleagues, and saying we need to shut down our K through 12. And that occurred on that Sunday, so it was pretty quick. And then it was a matter of still learning, and everything was changing every hour. Talking to colleagues, them trying to learn as much as they could, talking to DHEC a lot. But then we started having all of the multiplying factors and effects with every agency involved, whether it's, how do we take care of our vulnerable children with DSS while we're closed down? How do we, even as minute as I've had a truck driver call me and say, with the shutdown, I have nowhere to eat. How do we do this? A lot of, obviously now, unemployment issues. How do we, I had some horrible conversations of people trying to visit their relatives that's at end of life in hospitals, and hospitals closed down, and how we can get access to them. So hundreds of issues that came out of this, and ultimately it's changed, and data changes for me, and I hope my colleagues, and I hope anyone really is open to changing their opinion. For me, I'm excited. We just went public with, we brought testing to Pickens County locally, and that's what I've been working on for the past month. And After about 5-6 weeks or so working with DHEC and on the state plan, I realized that there was just too much red tape in there, and I saw an opportunity that we could bring it locally and have much more testing than we currently did. And so that's what I've been working on for the past month, and we just announced it today, and it's been one of the most rewarding things. So I think the question was, what do we do now that we're opening up? And for me, I still think it's too soon, but ultimately it's one man's decision. It's the governor's decision. And as long as it's in the realm of reasonableness, I'm not going to critique him on it. So I'm not going to be out in public and critiquing him on opening too soon. What I'm more focused on now is, okay, now that we're opening, how can we better protect the communities and especially the businesses? So to me, that comes down to testing. And as long as we can know where this is, know where any outbreaks are, and snuff it out as much and as quickly as possible, that will help out the community and the businesses. And then you also mentioned a huge thing with the plasma donations, and something that I've been pushing for 2-3 weeks now. With the testing, I'm working with the University of South Carolina with their lab there and a couple scientists, and they're the ones that are actually doing the plasma transfers, and they're saving people's lives. And sorry, I'm going to turn my phone off. They're saving people's lives that have been on ventilators for days, if not weeks. And the challenge is, because of HIPAA laws, DHEC can't tell them who the positives are. So it takes, all of us to get that word out, to raise awareness and to try to get the people who have been tested positive to come forward and then donate plasma that's ultimately going to save people's lives. And the last thing I'll say on it is, if we can either do one of the two things or both of them, if we can have adequate testing to where people are not concerned about immediately going and getting tested, if we can have enough testing to where if we do have a breakout that we can snuff it out and a business doesn't have to close like they've had to, or if we have this plasma enough in the bank to where people are not concerned about the mortality drops significantly, then we have won the day. And I think every day that passes, we're gaining on it. So I have hope.
Thank you.
You touched on this briefly with your answer for the last question, but as right now states are considering opening, what conditions should we open on? So there's been a lot of debate between saving the economy versus saving the lives. Do you believe there's a trade-off between them? And as a legislator, how do you strike a balance between the concerns on either side of that debate?
Yeah, it's a tough choice, right? And yeah, that's what we've had to be, that's what we've dealt with since March 11th. And fortunately or unfortunately, those same decisions are now going to be kind of transferred to business owners. So in the past week with this testing that we've done, we've had 2 businesses come in and they've had a positive employee. So they immediately had to make a decision of, am I going to stay open? Which both of them are no. If I do stay open, what happens if I spread it among the rest of my employees? What happens if I spread to some of my customers? And how will that affect business? So we can be, and I'm in a very conservative district, and I feel that I'm very conservative, and there is a segment of this is all overblown. But at the end of the day, when somebody goes into a business, they don't expect to risk their safety. And until we get that solved, nobody's going to have that confidence, or not enough people, certainly not what we had prior to this. So for us, we've been balancing all of those decisions. Just with the very first thing we were debating was closing K through 12. And we had to debate, was it worth it? With all of the factors that are going to go into it, how are we going to send 900,000 K through 12 students in South Carolina back home when they may not have structure at home to stay? And what will that cause? And obviously people brought up now that we've had some stay-at-home orders that were or were not successful, what happens if people are mentally depressed and have suicides, and what happens if they are on drugs and this causes more drug-related problems. So from the get-go, we've been working on it, and unfortunately or unfortunately, a lot of those decisions are going to go, now that government's sort of letting loose restrictions, it's going to go to individual businesses and individual people.
All right, Representative Collins.
Oh, you froze on me, Kwame.
We can't hear you, Q.
Affected by COVID-19, and I was just curious as to what the state is doing to address that issue.
Can you repeat the first part? You froze on me.
I apologize. I said I'm a member.
Oh, no.
Are you there, Q?
We can ask the question on his behalf.
Yeah. All right.
So early data shows that Black communities account for a disproportionate number of COVID-19 deaths in the United States. So how does South Carolina plan to address the impact of COVID-19 on communities of color?
Yeah, and that's a good question. And this thing, every day it changes. And I'm big on the data. I'm big on facts. And my initial guess to that question is that our minority communities, a couple things are occurring. Number one, they don't have the access that other communities do to healthcare. So that's a big issue. Number two, the getting out the word and the education to the communities that we need to be distancing. We need to mask when we go into public. I don't know if we've done that well enough. So fortunately, in my world, in the State House, I have some just tremendous African-American colleagues, and they represent minority communities. And from what I've seen on social media and from what I know of them, they're doing a tremendous job getting the word out to their communities. But ultimately, I do think the state has a role in, we need to focus on that, since that's, I forget what the latest statistic was, but the African-American death compared to the population per capita was far exceeded what the population was. So I know DHEC last Thursday, they announced an initiative to get into both rural communities and minority communities. And then they also focused on nursing homes, where I think something like 40% of our deaths are occurring in South Carolina. So I do think give DHEC credit and the state government credit on focusing on where we should.
Thank you so much. I had one more question. So you talked a little bit about this dealing with children who might be living in unsafe homes and how do we address that? And, you know, coronavirus has created so many challenges for schools. So how is the state working to support educators as well as students going through this time?
So it's being in education policy, we already had deficits and we already had a lot of weaknesses across the state. And again, unfortunately or fortunately, the coronavirus has highlighted those weaknesses. Again, with our rural populations and populations of poverty, we're having trouble with internet access. And when we shut schools down on a Sunday and then told them to have distance learning or e-learning, we knew that that was going to not go well. I believe there are 20 out of the 70 school districts that could not do e-learning. My county and Pickens County were fortunate in that they have been sort of one of the top 5 counties as far as e-learning, and they've been approved for the past 2 years of doing e-learning school days, makeup days. But we're just in the pilot project of that. And even though Pickens County was one of the first 5, they had only had 2 or 3 days total in 2 years of them doing it. So then you think about another county that had none of this infrastructure, was not approved, and a significant portion of their children didn't have access. So our idea was to have a bus that goes around that has some Wi-Fi on it. You can imagine how successful that is. So it just highlights the challenges that we already had in South Carolina. Moving forward, we're all thinking about how is fall going to go? August will be here before we know it. This virus is not going to be gone by then. So what do we do? And governor has set up this Accelerate South Carolina, and one of the subgroups to that is education, and they released some guidelines in the past week or so. And I don't know if we're going to be there, and I don't know if even higher institutions are going to be there. I don't know if Furman, if y'all are going to be able to meet come August, because what it comes down to is, do we have the infrastructure in place to be able to test the students if there is an outbreak and isolate the students and then move forward with everybody else? We currently don't have that capability, but I do have hope. We're gaining on this every day. But if push comes to shove with my local teachers and stuff, I would have to tell them right now, we're not going to have school starting August. It's going to be much different than what we're used to, just like the past 8 weeks has been. But we may figure it out by then. Just don't know yet.
All right. Do you happen to have time for one more question?
Oh yeah, absolutely.
All right. So what I've been hearing a lot about the debate is between the herd immunity aspect of the COVID-19 virus. And since this is a new virus and we've just been introduced as a population, a lot of people are thinking maybe it's best that we go ahead and get back out so everyone can just get introduced to the virus so we can see what's going to happen. So what is the state's opinion on that?
I think if you ask 170 of us, you'll have 170 different opinions. From my viewpoint, I don't agree with the herd immunity viewpoint, because that is basically giving up, in my opinion, on the successes of the medical community. 6 weeks ago, I didn't know anything about the plasma donation. Just in the past couple of weeks, didn't know about what MUSC is doing as far as testing fecal matter out of sewage plants and being able to trace whether there's an outbreak in a community by going to the sewage plants. I know Clemson is working on antibody testing. So I say all that to say, if we want to give up and say, yes, everybody get out, let's just get as sick as we can and just have as many deaths as we need to have and get over this hump. Well, first, that's going to take 6-8 months on its own to get herd immunity. You're going to have to get to 60-70% of the population. So that by itself is going to take months and months. And I have hope that and faith that our medical community, along with leaders, can come up with plans like we have been doing that will spread it out until we get this vaccine, or spread it out until we get treatments that we don't have to worry about deaths like everybody's fearful of.
Thank you.
I'm going to ask one more question.
Absolutely.
So you represent a conservative district. Describe yourself as a conservative. I've taken a couple political philosophy classes, and so part of what some writers would say as a conservative disposition is, being wary of change, a healthy skepticism or fear of threats from the outside environment. And so from that perspective, it seems like, a conservative approach to things, could be well suited to, work against this virus as in terms of policy responses, and just an attitude towards working through this. But like you mentioned, and I think I appreciate this, that you're trying to focus on the data and the facts as you're doing your work as a state legislator. And this gap has narrowed, but earlier in the pandemic, there was a gap that Republicans were far less concerned than Democrats with both the public health ramifications of this as well as the economic ones, which seems to go against what I was saying about, conservative concern with threats and things like that. And so I was wondering if you could speak to maybe why you think that's the case, or how conservatives should be thinking, maybe what they're doing well and how they should be thinking differently about this. And, that can go for across the political aisle, but just wondering if you might comment on that.
Oh yeah, and it's a good question. And it's, So with every issue, it's fascinating what is defined as conservative and what's defined as liberal, and ultimately how other things play a factor into it. For me, I'm a big fiscal conservative, and I approach things with how can we save money, how can we do things the most efficient way, but I have to have support and I have to have facts behind that. Now, unfortunately, some of my brethren, they're not so concerned about facts and not so concerned about different issues. And so it sort of depends on who you ask what that means. And I took some of the same philosophy classes, and I can tell you one thing they don't teach you in the philosophy classes is how the actual public reacts and what drives them. So unfortunately, media still drives a lot. And if some of my constituents see on a TV news program that one Republican leader is for something, then automatically they're for it, even though philosophically it is not conservative at all. Then they're a team player. And so it's tough, and it's tough to balance when, for me at least, I try my best not to play politics at all. And I think that's one reason I'm a bad politician. But I try to go down, have a philosophy and maintain that philosophy. And even if my own president, who's in my own party, is doing something I don't think is conservative, I'm going to speak out against that. I'm going to be against that. Now, that doesn't make me a good team player, but to me, it makes me more pure on the philosophical side. So, but I don't know if that's the right way. I'll be the first to admit, I don't know if that's the right thing to do in a representative democracy like we are. And since we're so partisan and we like to have just black and white issues. So for me, I guess the bad thing for Furman is it taught me that there's really no black and white issues. And if you have that mindset, you're probably in the minority on a lot of things, and you just have to be patient with people who are just black and white.
Thank you very much. Do y'all have any more questions? Awesome.
Yeah, thank you.
Well, Representative Collins, thank you for your insight and time and for joining us today.
Absolutely. But y'all take care. Let me know if you ever need anything.
Yes, sir. Thank you.
Thank you so much.